The fluorescent lights of the VA Medical Center in Tucson hummed their eternal song at 2:47 in the morning, casting sterile shadows across the intensive care unit. This was the hour when the world held its breath, when the boundary between life and death grew thin as gossamer, when the machines seemed to breathe louder than the patients they monitored. The night shift moved through this liminal space like ghosts themselves, speaking in hushed tones that barely rose above the rhythmic beeping of heart monitors and the soft hiss of ventilators. Kira Brennan moved among them with a quietness that had become her signature. At 28, she possessed the kind of face that people forgot easily, plain and unremarkable, framed by brown hair pulled back in a practical ponytail. Her scrubs hung loose on her slight frame, and she had the peculiar ability to blend into the background of any room, to become invisible even while standing in plain sight. The other nurses had given up trying to draw her into their conversations months ago. She was efficient, reliable, and completely unknowable. "The kid's working again," Patricia Evans muttered to Dr. Stephen Walsh near the nurses' station. Patricia was 52, a veteran of 3 decades in emergency medicine, with a face that had seen everything and been impressed by nothing. "Third double shift this week. Girl's going to burn herself out." Walsh glanced over his reading glasses at Kira, who was checking vitals on a patient in bed 7, with movements that were precise, almost mechanical. "She's good though, never makes mistakes, never complains. Hell, I don't think I've ever seen her smile." "She's running from something," Patricia said with the certainty of someone who had watched countless people try to outrun their demons through work. "Question is, what?" From his wheelchair near the window, Colonel Frank Aldridge listened to this exchange with the focused attention of a man trained to gather intelligence. At 68, Aldridge was a fixture in this ward, coming in twice a week for treatments related to lung damage sustained during the First Gulf War. His body had been ravaged by whatever chemicals Saddam's forces had unleashed in those desert campaigns, but his mind remained sharp as a combat knife. He watched Kira Brennan the way a hunter watches prey, patient and calculating. He had noticed things, small things that others missed. The way her hands never trembled, even during codes when everyone else's did. The peculiar efficiency of her movements, no wasted motion, every action serving a purpose. The fact that she never seemed startled by sudden noises, but rather froze for a microsecond, as if listening for something beyond what normal ears could hear. And most telling of all, the nightmares. He had seen her once in the break room at 4 in the morning, staring at nothing, her coffee grown cold in her hands, her eyes watching a horror movie that only she could see. The colonel knew that look. He saw it in his own mirror every morning. The emergency alarms shattered the night's fragile calm at 3:14 a.m. The sound was jarring, primal, cutting through the quiet like a scream. Bed 12. Charles Whitaker, 75 years old, Vietnam veteran, admitted 3 days ago with congestive heart failure. The ward erupted into controlled chaos. Patricia moved fast for a woman her age. Walsh was already running, and 2 other nurses converged on the room. But Kira was faster. She moved with a speed that seemed impossible, covering the distance in heartbeats, her training bag already in hand, though no one had seen her grab it. Whitaker was coding. His heart monitor showed the chaotic rhythm of ventricular fibrillation. His lips were turning blue, and his chest had stopped rising. Patricia started compressions immediately, forcing oxygenated blood through dying vessels. Walsh called for the crash cart, his voice sharp with urgency. "Get me epi, 1 milligram, Walsh ordered, trying to establish an IV line. His hands were shaking slightly. Night codes always did that, the adrenaline dump making even experienced physicians clumsy. But something was wrong. Whitaker's chest wasn't responding right to the compressions. The pressure wasn't building the way it should. Patricia felt it too, confusion crossing her face. Kira's eyes swept over the patient with an intensity that seemed to penetrate flesh and bone. She saw what they couldn't, her mind processing information with a speed born from training in environments where hesitation measured the difference between life and death. The tracheal deviation, the distended neck veins, the hyperresonance on the left side of his chest. "Stop compressions," Kira said. Her voice was quiet but carried absolute authority. Patricia looked up, annoyed. "What? He's in VFib. We need to—" "Tension pneumothorax," Kira stated, already moving. His lungs collapsed, air's building up in the chest cavity, crushing his heart. "CPR won't work. We need to decompress now." Walsh stared at her. "How can you possibly— Do you want him to die, doctor?" Kira's eyes met his, and for just a moment, Walsh saw something there that made him step back. Something hard and ancient and utterly certain. "Because he will, in about 90 seconds. From his wheelchair in the hallway, Colonel Aldridge sat forward, every nerve suddenly alert. Kira's hands moved with a surety that seemed almost supernatural. "I need a 14-gauge needle, now, and someone hold him steady." The crash cart nurse fumbled for the needle, her hands shaking. Kira took it without looking, her focus absolute. She ran her fingers along Whitaker's left chest wall, feeling for the landmarks. Second intercostal space, mid-clavicular line, the exact spot where the needle needed to go. "This isn't standard protocol," Walsh said, but his voice had lost its authority. He was watching something he didn't understand, seeing skills that shouldn't exist in a ward nurse. "Then you do it, sir," Kira said without looking up. "You have about 60 seconds left." Walsh froze. The procedure was technically simple, but terrifying in execution. Push a needle into a man's chest cavity, hoping to hit the exact spot where trapped air was crushing his heart. Miss by an inch, and you could pierce the lung, the heart itself, major vessels. It was a battlefield procedure, desperate medicine for desperate times. Kira didn't hesitate. She positioned the needle, angled it properly, and in one smooth motion, inserted it into Whitaker's chest. There was a hiss of escaping air, audible in the suddenly silent room, the sound of pressure equalizing, of death being pushed back. "Resume compressions," Kira ordered. "Normal rhythm. He should respond now." Patricia's hands moved automatically, following the quiet authority in that voice. One compression, 2, 3, and then Whitaker gasped, his back arching, his lungs suddenly able to expand, his heart no longer being crushed by the weight of trapped air. The monitor showed sinus rhythm. Irregular, but there. He was alive. The room stood frozen for 5 full seconds, everyone trying to process what had just happened. Walsh was the first to speak, his voice barely above a whisper. "Where did you learn that?" Kira was already cleaning up, her face betraying nothing. "Continuing education courses. I read a lot." "That's not a course," Patricia said, her voice shaking slightly. "That's combat medicine. That's what they do in war zones when there's no time for proper procedures." Kira didn't respond. She finished documenting the procedure in Whitaker's chart with neat, precise handwriting, then quietly left the room. Colonel Aldridge watched her walk past, saw the slight tremor in her hands that she hid by clasping them together, saw the way she moved to the far corner of the hallway and stood there, staring at nothing, breathing slowly and deliberately. The breathing pattern of someone fighting off a panic attack. The breathing pattern of someone who had been trained to control their body's responses to trauma. He wheeled himself closer, moving with the practiced silence of an old soldier. When he spoke, his voice was gentle. "That was remarkable work, young lady." Kira's head snapped toward him, her body going rigid for just a microsecond before forcing itself to relax. Another tell, another sign. "Just doing my job, Colonel Aldridge. You know my name." It wasn't a question. "You're here twice a week. I know all the regulars." Aldridge studied her face, reading the micro-expressions that flickered across it like shadows. "That needle decompression, I've seen that done exactly 3 times in my life. Twice in Desert Storm, when we didn't have proper medical support. Once in Fallujah, watching a Navy SEAL medic work on a Marine who'd taken shrapnel to the chest. Kira's face remained neutral, but her hands tightened almost imperceptibly. "It's in the emergency medicine textbooks, sir." "The textbooks tell you how," Aldridge said quietly. "They don't teach you to do it without hesitation. They don't teach you that absolute certainty. That comes from someone else. That comes from doing it when someone's shooting at you." For a long moment, they looked at each other. Kira's eyes were the color of storm clouds, gray and turbulent, and in their depths, Aldridge saw recognition. She knew that he knew, and she was deciding whether to run or to stay. "I don't know what you think you saw, Colonel, but I'm just a nurse. I've never been in combat. I've never served." "Then you're the most naturally gifted civilian I've ever met," Aldridge said. "Or you're lying. I'm pretty good at spotting lies, Miss Brennan. Had a lot of practice." Kira straightened, her voice gaining an edge. "With respect, sir, you need to let this go." "Can't do that." Aldridge's voice was matter-of-fact. "I've been coming to this hospital for 5 years. I've watched nurses come and go. Some are good, some are adequate. Some shouldn't be trusted with a goldfish. But you're something else entirely. You move like someone who's been trained to work under fire. You assess situations like someone who's done triage in mass casualty events. And tonight, you performed a procedure that most ER doctors would hesitate to attempt." He paused. "So no, I can't let it go, because I know what PTSD looks like. I've had it for 30 years, and you have it too." Kira's mask slipped for just a moment, and Aldridge saw the pain beneath it, raw and bleeding and carefully hidden from the world. "I'm fine, Colonel." "That's what I told myself for 2 decades, Aldridge said softly. "Right up until I wasn't. Right up until I nearly ate my service pistol in my garage one Tuesday afternoon. Someone stopped me, someone who cared enough to notice. So I'm noticing you, Miss Brennan, and I'm telling you, whatever you're carrying, you don't have to carry it alone." Kira's jaw tightened. For a moment, Aldridge thought she might actually tell him. But then the walls came back up, the defenses rebuilt themselves, and she was once again the invisible nurse who blended into backgrounds. "My shift ends at 7. If you'll excuse me, Colonel, I have patients to check on." She walked away, her footsteps quiet on the linoleum floor. Aldridge watched her go, troubled. He had seen that kind of self-isolation before, usually in soldiers who had done things they couldn't talk about, seen things they couldn't unsee. The ones who tried to bury themselves in work, to lose themselves in service to others, anything to avoid the memories that waited in the quiet moments. The rest of the shift passed in relative calm. Kira made her rounds with her usual efficiency, checking medications, adjusting IV drips, speaking quietly with patients who woke confused in the darkness. To anyone watching, she was simply a dedicated nurse doing her job well. But Aldridge kept watching, and he kept seeing the signs. The way she positioned herself in every room with her back to a wall and her eyes on the exits. The way she never turned her back to doorways. The way she moved through the ward on a route that seemed random but actually covered every angle, every approach, a patrol pattern disguised as hospital rounds. These weren't conscious movements. They were reflexes, muscle memory, the kind of training that became so deeply ingrained that it outlasted everything else. At 5:30 a.m., Kira took her break in the staff lounge, a small room with a couch that had seen better days, a coffee maker that produced something vaguely resembling coffee, and a window that looked out over the parking lot. She sat in the far corner, her back against the wall, her hands wrapped around a cup of black coffee that she didn't drink. Aldridge found her there 20 minutes later. "What I see when I close my eyes?" Aldridge asked. "No, I don't want to know," she said. "I'm not going to tell you." "You're not going to tell me what you're not going to tell me," he said. "I'm not going to tell you what I'm not going to tell you." "You're not going to tell me what you're not going to tell me," she said. "I'm not going to tell you what I'm not going to tell you." "You're not going to tell me what you're not going to tell me," he said. "I'm not going to tell you what I'm not going to tell you." "You're not going to tell me what you're not going to tell me," she said. I'm not going to tell you what I'm not going to tell you. You're not going to tell me what you're not going to tell me, he said. I'm not going to tell you what I'm not going to tell you. You're not going to tell me what you're not going to tell me, she said. I'm not going to tell you what I'm not going to tell you. You're not going to tell me what you're not going to tell me, he said. I'm not going to tell you what I'm not going to tell you. You're not going to tell me what you're not going to tell me, she said. I'm not going to tell you what I'm not going to tell you. You're not going to tell me what you're not going to tell me, he said. I'm not going to tell you what I'm not going to tell you. You're not going to tell me what you're not going to tell me, she said. I'm not going to tell you what I'm not going to tell you. You're not going to tell me what you're not going to tell me, he said. I'm not going to tell you what I'm not going to tell you. You're not going to tell me what you're not going to tell me, she said. I'm not going to tell you what I'm not going to tell you. You're not going to tell me what you're not going to tell me, he said. I'm not going to tell you what I'm not going to tell you. You're not going to tell me what you're not going to tell me, she said. I know what I see when I close my eyes, Aldridge asked, settling his wheelchair near the window. I see a convoy, 3 Humvees and a supply truck. We're driving through the Iraqi desert, and the sky is this weird yellow color from all the oil fires Saddam's forces lit. My platoon, 32 men, were laughing about something stupid, I can't even remember what, and then the world explodes. He paused, his hands gripping the wheelchair arms. Friendly fire. A 10 Warthog making a strafing run. Got bad coordinates from command. 30mm rounds tearing through our convoy like we were made of paper. 16 men died in about 20 seconds. 16 men I was responsible for. And I lived because I was in the last vehicle. Because I was lucky. Because I was a coward who sent his men ahead. Kira's eyes finally moved to him, and he saw recognition there. The recognition of someone who understood that particular flavor of guilt. You weren't a coward, Colonel. You don't know that. Yes, I do. Her voice was quiet but certain. Because cowards don't spend 30 years coming to a VA hospital twice a week for treatment they could get anywhere. They don't spend their time watching over other patients, making sure the staff is taking care of people. Cowards run. You stayed. And what are you doing, Miss Brennan? The question hung in the air between them, sharp and pointed. Kira looked away. I'm working. I'm helping people, that's all. That's running, Aldridge said gently. Just a different kind. You're running so hard into work that you don't have to stop and think. Don't have to remember. But it doesn't work, does it? The memories find you anyway, usually at about 3 a.m. when you're alone and the defenses are down. Kira's hands trembled slightly around her coffee cup. You need to stop, Colonel. Can't do that. Won't do that. His voice was firm but kind. I've lost too many people to silence. Too many soldiers who couldn't talk about what they'd seen, what they'd done, what had been done to them. They ate their weapons, or wrapped their cars around trees, or just slowly poisoned themselves with whatever would make the pain stop. I'm not watching another one go down that road. Not if I can help it. I'm not a soldier. Maybe not, but you've seen combat. I'd stake my life on it. Kira stood abruptly, her chair scraping against the floor. My shift is almost over. I need to finish my charts. She moved toward the door, but Aldridge's voice stopped her. I'm going to keep watching, Miss Brennan. I'm going to keep noticing. And when you're ready to talk, I'll be here. That's a promise. Kira paused in the doorway, her back to him. Some things are classified, Colonel. Some secrets need to stay buried. Classified? Aldridge's voice sharpened with interest. That's a very specific word choice. But Kira was already gone, disappearing into the hallway like smoke. Kira drove home as the sun rose, her hands steady on the wheel, despite the exhaustion that pulled at her bones. Her apartment was small and spare, a one-bedroom unit in a building that had seen better decades. The furniture was minimal, a couch, a small table, a bed. No pictures on the walls, no personal items displayed. It looked less like someone's home and more like a place someone was temporarily occupying while waiting to move on. The only photograph in the entire apartment was hidden in the back of her closet, in a box that she never opened, but could never throw away. She took it out now, sitting on her bed in the growing morning light, looking at faces she had tried so hard to forget. 12 men in desert fatigues, their faces weathered by sun and wind and war. They were smiling, arms around each other's shoulders, the kind of brotherhood that only forms in the crucible of combat. And standing among them, smaller and younger, but wearing the same smile, was a woman who looked like Kira, but wasn't quite. That woman had still believed in something. That woman hadn't yet learned what it meant to lose. In the photo, a young Marine with bright blue eyes and an easy grin had his arm around her shoulders. Private First Class Connor Whitmore, 19 years old, from a small town in Montana. He had joined the Marines because his father had been a Marine, and his grandfather before that. He had believed in honor and duty and protecting the innocent. He had believed right up until the moment the RPG had torn him apart while covering her extraction. Kira's hands began to shake, the photograph trembling in her grip. She forced herself to look at Connor's face, to remember his voice, the way he had called her Doc, with a respect that always seemed too much for someone barely older than him. She forced herself to remember the last thing she had heard on the radio before the secondary explosion had knocked her unconscious. "Tell Doc I bought her time. Get our guys out." She had woken up 3 days later in a field hospital with a new name, a new identity, and a hole in her chest where her purpose used to be. The mission had been classified. The operation had officially never happened, and she had officially died in that secondary explosion. The 11 Marines she had saved had been told their corpsman was KIA, clean, simple, necessary for operational security, and utterly devastating. Kira put the photograph away, shoving the box back into the darkness of the closet where it belonged. She lay down on her bed, still fully clothed, staring at the ceiling, knowing she wouldn't sleep. She never really slept anymore, just closed her eyes and watched the same movie play over and over. The flash of the explosion, Connor's body thrown backward, the sound of her own screaming that she couldn't even remember making. Her phone buzzed. A text message from the hospital scheduling system. They needed someone to cover another shift tonight. Someone had called in sick. They always needed someone. Kira stared at the message for a long moment, then typed her response. She would take the shift. She always took the shifts. Because work meant not thinking, and not thinking meant survival. And survival was the only thing she had left. But as she lay there in the morning light, she couldn't shake the feeling that something had changed. Colonel Aldridge had seen her. Really seen her. For 8 years, she had been invisible. Just another nurse in just another hospital. Nobody special. Nobody worth noticing. And in one night, that carefully constructed invisibility had shattered. 2 days later, Kira was back on night shift, moving through the familiar routines with the same mechanical efficiency. But she could feel Aldridge's eyes on her, watching, cataloging, building his case. It made her skin prickle with anxiety. She had spent 8 years perfecting the art of being unremarkable. And now this old colonel with his sharp mind and sharper instincts was threatening to unravel everything. At 11:23 p.m., she was restocking supplies in the medication room when she heard it. The sound that every medical professional dreads. A woman screaming, raw and terrified. The kind of scream that comes from watching someone you love die. Kira dropped the supplies and ran. The ER entrance, a woman in her 30s, covered in blood that wasn't hers, cradling a small boy who couldn't have been more than 5. The child's face was pale, his lips blue, and he wasn't breathing. "He was in the pool," the woman was sobbing. "I looked away for just a second. Just 1 second. Please, you have to save him. Please." Kira took the child from the mother's arms with gentle but firm hands. Drowning victim, approximately 5 years old, no pulse, no respirations, skin cold and clammy. She called for the pediatric crash cart even as her hands began compressions, her body falling into the rhythm of CPR with the practiced ease of someone who had done this too many times. Dr. Walsh appeared, along with Patricia and two other nurses. But Kira was already working, her focus absolute. She intubated the child with steady hands, secured the airway, began bagging. Walsh started an IV line, pushed epinephrine. The monitor showed a flat line, the sound that haunted every medical professional's nightmares. "How long was he under?" Walsh asked the mother. "I don't know," she sobbed. "Maybe 3 minutes? 4? I pulled him out as fast as I could. He wasn't breathing. He wasn't moving." 4 minutes. In drowning cases, that was often too long. Brain damage, permanent disability, or death. The odds weren't good, but Kira kept working. Her hands moved with mechanical precision, compressions at exactly 100 per minute, stopping only to allow ventilation. She had learned this rhythm in a place far from this sterile hospital, had learned it while mortar rounds exploded nearby, while gunfire echoed across desert compounds, while Marines died because she wasn't fast enough, or skilled enough, or lucky enough. "Kira," Walsh said gently after 5 minutes. "We should—" "No," she said flatly. "Keep pushing epi. Keep bagging. We're not stopping." "The protocol says—" "I don't care what the protocol says," Kira snapped, her voice sharp enough to cut. "This child is 5 years old. He has his whole life ahead of him. We're not giving up. Not yet." Walsh looked at Patricia, who shrugged. They had all heard the statistics. After 5 minutes of CPR with no response, the chances of meaningful recovery were minimal. But something in Kira's face, something hard and desperate and utterly unwilling to accept defeat, made them keep working. 7 minutes. 8. The mother was being held back by security, her screams of anguish filling the ER. Other patients watched with horrified fascination, witnessing the brutal reality of emergency medicine, the thin line between life and death. At 9 minutes and 43 seconds, the monitor beeped. Once. Then again. A rhythm. Weak, irregular, but there. "We have a pulse," Patricia said, her voice shocked. "Kira, we have a pulse." The child gasped, water and foam coming from his mouth. His eyes flickered open, confused and terrified. He was alive. Against all odds, against every statistic, he was alive. The ER erupted in relieved chaos. They moved the child to intensive care, the mother following, crying now with relief instead of grief. Walsh started barking orders for tests, for monitoring, for all the things that needed to happen to ensure the child's recovery. And Kira stood in the now empty trauma bay, her scrubs soaked with pool water and sweat, her hands shaking so badly she had to grip the edge of the gurney to keep them still. Colonel Aldridge wheeled into the room. He had watched the entire code from his position near the nurses' station, had seen Kira refuse to give up when everyone else was ready to call it, had seen that fierce, unbreakable determination that spoke of training deeper than any nursing school could provide. 9 minutes, he said quietly. "You worked on that child for 9 minutes. Most protocols say to stop at 5. Most protocols are written by people who've never had to make that call in the field," Kira said, her voice hollow. "Who've never had to decide which wounded Marine gets the last unit of blood. Who've never had to perform CPR while someone's shooting at you." She stopped, realizing what she'd said. The admission hung in the air between them like smoke. Aldridge wheeled closer. "Afghanistan or Iraq?" Kira's jaw tightened. "I told you, I never served. And I told you I'm good at spotting lies." Aldridge's voice was gentle but implacable. "I made some calls, Miss Brennan. Called in favors from old friends at the VA. Your name doesn't appear in any standard military databases, but it does appear in one place, a heavily redacted personnel file. Classified. Most of the information is blacked out, but I could see enough. Navy Corpsman, deployed 2018. Mission details classified. Status, KIA. Kira's face had gone pale. You had no right. I had every right, Aldridge said firmly, because I've watched you for months now, and I've seen someone slowly destroying themselves. Someone carrying guilt that's eating them alive. Someone who saves strangers with the kind of desperate intensity that suggests they're trying to make up for someone they couldn't save. He paused. Who was it, Kira? Who didn't make it home? The use of her first name, the gentleness in his voice, cracked something inside her. She sank into a chair, her strength suddenly gone. His name was Connor, she whispered. Private First Class Connor Whitmore, 19 years old. He loved his family, loved the Marines, believed in all the things we tell young men before we send them to die. She looked at Aldridge with haunted eyes. He died covering my extraction, bought me time to get the wounded loaded, and I was unconscious, so I couldn't save him. Couldn't do anything but wake up 3 days later and learn that he was gone, and that officially, so was I. Why did they declare you KIA? Because the mission went sideways, Kira said bitterly. Bad intelligence. We walked into an ambush. 8 Marines wounded, 1 killed. Someone had to take the fall for it, and it's easier to blame a dead corpsman than to investigate whether someone in command screwed up. So they gave me a choice. Stay dead and protect the men I saved from bureaucratic fallout, or come back and watch their families lose everything while Congress investigated what went wrong. That's not a choice, Aldridge said. That's coercion. That's the military, Kira replied. That's how it works when politics matter more than people. Before Aldridge could respond, Patricia appeared in the doorway. Kira, there's an ambulance incoming. Gunshot wound to the chest. Victim's a Marine veteran. They're asking for you specifically. The paramedic said the patient keeps asking for Doc Brennan. Kira's world tilted. For 8 years, she had been invisible. Just another nurse in just another hospital. No one from her past life had ever found her. No one had ever connected the anonymous ward nurse with the supposedly dead Navy corpsman. Until now. The ambulance doors burst open at 11:47 p.m., and Kira's carefully constructed world shattered like glass. 2 paramedics rushed through with a gurney, their faces grim with the knowledge that their patient was dying. The man on the stretcher was broad-shouldered and muscular, his civilian clothes soaked with blood that looked black under the fluorescent lights. His face was pale, lips turning blue from oxygen deprivation, and his breathing came in rapid, shallow gasps. Gunshot wound to the left chest, the lead paramedic reported, maintaining pressure on the wound with both hands that were already soaked crimson. Found him in an alley downtown. Gang shooting, multiple witnesses. Victim's name is Wyatt Holbrook, Marine veteran. He's had 2 units of O-negative in the field. We tried to intubate but couldn't get past the blood in his airway. Blood pressure 70/40 and dropping. He keeps saying a name, keeps asking for someone called Doc Brennan. The trauma bay lights blazed to life, turning the room into a theater of desperate medicine. Dr. Walsh was already scrubbing in, calling for surgery to be prepped. Patricia moved with her characteristic efficiency, pulling blood from the refrigerator because chest wounds always meant massive hemorrhage. Kira stood frozen for just a heartbeat, her mind screaming at her to run, to hide, to maintain the fiction that had kept her safe for 8 years. But then training overrode panic. She moved to the gurney, her hands already reaching for the patient, and that's when she saw his face clearly for the first time. Staff Sergeant Wyatt Holbrook, 2nd Squad Leader, MARSOC Team 3, one of the 11. Time fractured. The sterile hospital faded, replaced by desert sand and the acrid smell of cordite. She saw Holbrook as he had been 8 years ago, younger and covered in dust, his chest punctured by shrapnel, his eyes wide with the knowledge that he was dying. She saw her own hands, steady despite the gunfire, inserting a chest tube while explosions shook the ground beneath him. She heard his voice, weak but trying to joke. "Doc, if I don't make it, tell my girl I love her." And her response, fierce and certain. "You're going to tell her yourself, Marine. Now shut up and let me work. Kira! Patricia's sharp voice snapped her back to the present. We need to move, now. They transferred Holbrook to the trauma bay table. His eyes fluttered open, unfocused and glazed with shock and pain. They wandered across the ceiling, then found Kira's face. For a moment, there was nothing. Then recognition bloomed, followed immediately by confusion. Then something that looked like wonder mixed with terror. Doc Brennan? His voice was barely a whisper, blood-flecked and weak. The words came out slurred, fighting through pain and shock. No, that's impossible. You can't be here. They said you were dead. They told us, memorial service, empty casket. You can't be real. The trauma bay fell silent except for the urgent beeping of monitors. Everyone was staring now. Patricia's hands had paused mid-motion. Walsh's eyes moved between Kira and the patient, trying to process this impossible reunion. Kira's professional mask slammed down so hard it was almost audible. Her voice came out steady, calm, betraying nothing of the earthquake happening inside her chest. Wyatt, stay quiet. Don't try to talk. Save your strength. I'm going to save you. Again, she didn't say. She was going to save him again. Dr. Walsh looked between them, his confusion evident. You know this patient? But Kira was already working, her hands moving with a speed and precision that transcended normal nursing practice. She cut away Holbrook's shirt with trauma shears, exposing the wound. Entry wound left anterior chest, approximately 5th intercostal space. No exit wound visible. Bullet still inside, possibly lodged near the heart or great vessels. The wound bubbled with each labored breath, air escaping from the punctured lung, and the entire left side of his chest wall moved wrong. Paradoxical breathing that meant broken ribs and probable hemothorax. Blood was pooling in his chest cavity, compressing the lung, pushing the heart aside. He was drowning in his own blood, and they had minutes at most before his cardiovascular system collapsed completely. Chest tube kit, Kira said, her voice carrying absolute authority that left no room for debate. We need to drain the blood from his pleural cavity before it tamponades the heart. Patricia, start another large bore IV, 18 gauge, push normal saline wide open. Get me 4 units of O negative from the blood bank. Type and cross for 8 more. Doctor, I need you to call surgery now. This bullet needs to come out, and it needs to come out in an OR under general anesthesia, not here. Walsh stared at her. This wasn't a nurse making suggestions. This was someone giving orders with the confidence of someone who had done this before, who knew exactly what needed to happen and when. Someone who had made these life or death decisions under circumstances far worse than a well-lit trauma bay. How can you possibly know all that from a quick assessment? Walsh asked, but his hands were already moving to follow her instructions. Something in her certainty was compelling. Because I've seen this exact injury pattern before, Kira said, her voice sharp, her patience for questions exhausted by the urgency of the situation. Her hands were already prepping the chest tube insertion site, swabbing betadine in quick, efficient strokes. Gunshot wound, left chest, developing tension pneumothorax with hemothorax. The bullet trajectory suggests it's lodged near the left ventricle or the descending aorta. If we don't decompress this chest in the next 3 minutes, his heart will stop. If we don't get that bullet out in the next 30 minutes, he'll either bleed out or the bullet will shift and lacerate something vital. So unless you want to explain to his family why we stood here debating while he died, I strongly suggest we move. Now. Her hands were already making the incision between his ribs, the scalpel moving with practiced precision. She used a clamp to tunnel through the tissue layers, blunt dissection to create a path for the chest tube. The technique required absolute confidence in steady hands. One wrong move, and she could lacerate an intercostal artery or puncture the lung further. Holbrook's hands suddenly shot out, gripping Kira's wrist with surprising strength for someone so close to death. His eyes found hers, wide and desperate, filled with a confusion that fought through the pain and shock. Afghanistan, he gasped, each word costing him. The ambush, October 2018. You were there. You put a chest tube in me while they were shooting at us. You told me stories about Montana to keep me conscious. You promised, he coughed, blood speckling his lips. You promised we'd all get home. And we did. All of us except Connor, and except you. They told us you died in the secondary explosion. They had a memorial. We buried an empty casket. I gave a eulogy. I told your story to a room full of Marines who'd never met you. The trauma bay had gone absolutely silent. Everyone was frozen, staring at this impossible scene. Patricia's mouth hung open. Walsh had stopped moving entirely. And from his position near the door, Colonel Aldridge leaned forward in his wheelchair, his eyes sharp with vindication and concern. Kira's mask cracked just for a second, and Walsh saw something in her eyes that made him take an involuntary step backward. Grief, raw, bleeding grief that had been carefully hidden for so long that when it emerged, it was almost unbearable to witness. But beneath the grief was something else, determination, the fierce, unbreakable determination of someone who had pulled men back from death before and would damn well do it again. I know, Wyatt, she said softly, her voice momentarily gentle before the steel returned. I know what they told you. I know about the memorial. I know you've spent 8 years thinking I was gone, but I'm here now, and you're not going to die on me. Not in Afghanistan, and not in Tucson. Do you understand me? You're going to live. She turned back to Walsh, and her voice regained its commanding edge. Chest tube, insertion. Now, we're out of time. Walsh handed her the large-bore chest tube with hands that trembled slightly. He watched, along with everyone else in the room, as she inserted it with a confidence that spoke of extensive practice. When the tube entered the pleural space, blood gushed out, dark and thick and terrifyingly voluminous. 300 milliliters in the first few seconds, 400, 500. Holbrook's chest cavity had been slowly filling with blood, each heartbeat pumping more into the space where it didn't belong, compressing his lung, pushing his mediastinum to the side. As the blood drained through the tube into the collection chamber, Holbrook's oxygen saturation began to climb on the monitor. 78%, 82, 87, 91. His breathing, which had been rapid and shallow, began to slow and deepen. His lips, which had been blue with hypoxia, started to pink up. He gasped, his body suddenly able to draw a full breath for the first time since the bullet had torn through his chest. His eyes found Kira again, and this time they were clearer, more focused, filled with a wonder that bordered on religious awe. You're real, he whispered, his voice stronger now. You're actually real. I thought I was dying, thought my brain was showing me angels or something, showing me the person I wished could save me. Tears began to stream down his face. Doc, the team. Does the team know you're alive? Does McClellan know? Garrett? Nash? They need to know. Jesus Christ, they need to know. We've spent 8 years mourning you. 8 years living with the guilt that we made it home, and you didn't. Kira's jaw tightened, her face becoming an expressionless mask once more. They can't know, Wyatt. You understand? Whatever you think you saw here tonight, whatever you think you remember, you need to forget it. Are you insane? His voice cracked with emotion and disbelief. You think I'm going to just forget that you're alive? You think I'm going to go back to the team and not tell them that their corpsman, the woman who saved all our lives, is walking around Tucson pretending to be dead? The mission was classified, Kira said, her voice dropping to barely above a whisper, each word carefully enunciated. You know what that means, Wyatt. You signed the same papers I did. You know what happens when classified operations become public knowledge. People get court-martialed, careers get destroyed, pensions get revoked. Whoever gave you your story about what happened that day, Whoever told you I was KIA, they did it for reasons that are above both our pay grades. From his wheelchair near the door, Colonel Aldridge spoke for the first time, his voice cutting through the tension like a command. What operation? What mission are we talking about? Everyone turned to look at him. He sat there ramrod straight despite his age and illness, his eyes locked on Kira with the intensity of someone conducting an interrogation. His years of military training were evident in his posture, his tone, his refusal to be ignored. Afghanistan, Aldridge continued, not waiting for an answer. October 2018. You served as a Navy corpsman attached to a Marine unit. MARSOC, if I had to guess, based on the fact that this gentleman's tattoo shows the Marine Special Operations insignia. He nodded toward Holbrook, whose forearm bore the distinctive dagger and globe marking. Special Operations, Black Ops, the kind of missions that don't exist on paper, the kind where people disappear and the government denies they were ever there. Kira's face had gone completely blank, the professional mask rebuilt and reinforced. I don't know what you're talking about, Colonel Aldridge, and even if I did, this is neither the time nor the place to discuss it. My patient needs surgery immediately. Your patient, Aldridge said quietly, is a United States Marine who has been grieving your death for 8 years. I think he deserves to understand why you let him think you were dead, why you let his entire team think you were dead. What was so important that it required faking your own death and hiding in a VA hospital for nearly a decade? The words hung in the air, heavy with accusation and confusion and demand for truth. Patricia had moved closer, her experienced eyes taking in the entire scene. Walsh stood with his hands still gloved and raised, caught between his medical duties and his desperate curiosity about what was unfolding. Kira looked at each of them, saw the questions in their faces, saw the moment when her 8 years of carefully maintained anonymity finally collapsed completely. She opened her mouth to respond, but before she could speak, the trauma bay doors burst open again. A man stood in the doorway, not in dress blues but in civilian clothes, jeans and a leather jacket that couldn't hide the military bearing in every line of his body. He was perhaps 38, with the weathered face of someone who had spent years in harsh climates, and eyes that had seen too much. Gray touched his temples. Scars marked his hands. He moved with the controlled precision of someone who was always aware of his surroundings, always ready for threats. His gaze swept the room with tactical efficiency, cataloging exits in people and potential dangers in a single glance. Then his eyes found Kira, and he froze. Every muscle in his body went rigid. The color drained from his face, and when he spoke, his voice was rough with an emotion so powerful it seemed to physically hurt him. Holbrook called me from the ambulance, the man said, his words coming slowly as if he was having trouble forming them. Before he lost consciousness, said I needed to get here, said there was something impossible I needed to see, said, he stopped, swallowed hard, then continued. He said Corman Brennan was alive, and I told him he was delirious from blood loss, told him to save his strength, but he kept insisting, kept saying your name. He took a step closer, his hand reaching out as if to verify that she was real. They told us you died. We had a memorial service, full military honors, empty casket because there wasn't enough left to bury. 21 gun salute, taps, your name read aloud with all the other fallen. We mourned you, Doc. For 8 goddamn years we mourned you. Kira's breath caught in her chest. She knew that voice as well as she knew her own. Knew that face, though it was older now, more weathered. Gunnery Sergeant Travis McClellan, team leader, the man who had carried her to the medevac bird after the explosion, who had held her hand while she drifted in and out of consciousness, who had been the last person she saw before they loaded her onto the helicopter that was supposed to take her to safety. Hello, Gunny, she said quietly, her voice barely audible. McClellan stared at her as if she were a ghost made flesh, a supernatural thing that violated every law of nature. His hand finally touched her shoulder, fingers pressing against fabric and bone to verify solidity, reality. When he felt the warmth of living tissue under his palm, he jerked back as if burned. How? The word came out broken. How is this possible? We were told you died in the secondary explosion. They showed us the report. They showed us the crater where the IED detonated. They told us you were at the center of it, that there wasn't enough left of you to fill a regulation casket. They lied, Kira said flatly. Or rather, they told you a version of the truth that served their purposes. I was near the explosion. I was knocked unconscious. But I didn't die. I woke up 3 days later in a field hospital with a new identity and orders to stay dead. Why? McClellan's voice rose, anger bleeding through the shock. Why would they do that? Why would they fake your death? What possible reason could there be for letting your team think you were killed in action? Because someone needed to take the fall, Kira said bitterly. Because the mission failed. Because we lost Connor. Because 8 of you got shot to hell, and someone in command wanted to know whose fault it was. And it's a lot easier to blame a dead corpsman than to investigate whether someone gave us bad intelligence that walked us into an ambush. McClellan's eyes widened as the implications hit him. They scapegoated you. The brass covered their asses by making you disappear, by declaring you KIA and sealing the record so no one could ask questions. Something like that, Kira said. And in exchange, you all got to go home, got to keep your benefits and your pensions and your careers. Garrett got to see his daughter grow up. Nash got to walk his sister down the aisle. Holbrook bought a house with his wife. You all got futures. So I stayed dead. It seemed like a fair trade at the time. A fair trade? McClellan's voice was incredulous, his face flushing with anger. You think we would have wanted that? You think any of us would have chosen our careers over your life? Over knowing the truth? It wasn't about your careers, Kira said, her own voice rising to match his. It was about your families. They made it clear what would happen if I came back. Investigations, congressional hearings, questions about mission parameters and intelligence failures and command decisions. Your families would have lost everything while politicians used you as pawns in their games. So yes, I made a choice. I stayed in the grave they dug for me. Dr. Walsh, who had been standing frozen throughout this exchange, finally found his voice. This is all very dramatic, but my patient needs surgery. Now. He's stable for the moment, but that bullet is still in his chest, and every minute we delay increases the risk of catastrophic bleeding. Then get him to the OR, Kira said. Do your job, doctor. Save his life. That's all that matters right now. As the surgical team began prepping Holbrook for transport, he reached out again, his hand finding Kira's wrist. I'm telling them, he said, his voice weak but determined. I'm calling everyone. Nash, Garrett, Foster, all of them. They deserve to know you're alive. You'll put them in danger, Kira said urgently, leaning close to his ear. You'll put yourself in danger. The people who created my cover story, who made me disappear, they had reasons. Good reasons. Reasons that kept people alive and safe. What reasons could possibly justify this? Holbrook asked. What could be worth letting your own team think you were dead for 8 years? Kira's control finally fractured. Her voice came out raw, stripped of its careful neutrality, filled with 8 years of suppressed pain. Because the mission went bad, Wyatt. Because we were supposed to raid a weapons cache, and instead we walked into a prepared ambush. Because 11 of you got shot, and 1 of you died, and someone needed to be blamed for the intelligence failure. So they blamed the person who wasn't there to defend herself. The person who was officially dead. She stopped, breathing hard, realizing she had said too much. But the pressure valve had been opened, and the words kept flowing like blood from a severed artery. They told me that if anyone knew I survived, it would raise questions. Questions about what really happened that day. Questions about who authorized the mission and why the intelligence was so catastrophically wrong, and whether someone in command screwed up and got Marines killed. So I stayed dead. I let you have your memorial service. I let you all mourn. And I've spent 8 years working in this hospital, trying to save enough lives to make up for the fact that I couldn't save. She cut herself off, but everyone in the room knew what she had been about to say. Couldn't save Connor. Holbrook's eyes widened with understanding and pain. Connor Whitmore. You're talking about Connor. The name landed like a physical blow. Kira's face drained of color, her hands gripping the edge of the gurney so hard her knuckles turned white. Colonel Aldridge wheeled closer, his expression both sympathetic and intent. He was your spotter, Holbrook said softly, his voice gentle despite his own pain. He stayed behind when we loaded into the bird. He covered our extraction. We heard him on the radio saying he could slow the insurgents down, that he could buy us time. He took an RPG while we were lifting off. By the time we could get back to him, Holbrook's voice broke. By the time we could get back, there wasn't anything left to recover. We thought you died in the same explosion, the secondary IED. They told us you and Connor were both KIA. They told us you were together when it happened, that at least you weren't alone. I was unconscious, Kira said, her voice barely audible. Tears were streaming down her face now, and she made no effort to hide them. I woke up 3 days later in a field hospital. They told me Connor was gone. They told me everyone thought I was gone too. They gave me a choice that wasn't really a choice. Stay dead and protect the mission, or come back to life and watch everything fall apart. Watch careers get destroyed. Watch the families of the men I saved get dragged through investigations and congressional hearings about what went wrong. She looked at Holbrook, her eyes bright with unshed tears and old grief. So I ask you, Wyatt, what would you have done? Holbrook was quiet for a long moment, his face reflecting the impossible complexity of the situation. Then he said, his voice soft but certain, I would have done exactly what you did, and I would have hated myself for it every single day since. Good guess, Kira said with a bitter smile that held no humor. Now you need to go to surgery before that bullet decides to move and pierce your heart or tear open your aorta. As they wheeled Holbrook toward the operating room, he called back, his voice carrying despite his weakness. I'm still telling them, Doc. They deserve to know, and so do you. You deserve to stop being dead. You deserve to stop punishing yourself for being the one who survived. The trauma bay doors swung shut behind him, leaving Kira standing in the blood-stained room with Patricia, Walsh, Aldridge, and McClellan. The silence was thick and uncomfortable, weighted with revelations that couldn't be taken back and questions that demanded answers. Patricia spoke first, her voice uncharacteristically gentle. How long, kid? How long have you been here, hiding in plain sight? 8 years, Kira said dully. 8 years, 2 months, 17 days. I could tell you the hours if you want. I've counted every single one. And you've been working here the whole time? Walsh asked. Working doubles and triples, never taking vacation, never talking about your past? Just existing? Not existing, Kira corrected. Surviving. There's a difference. Existing implies some kind of life. I've just been surviving. One shift at a time, one patient at a time, trying to save enough people to balance the scales. What scales? Aldridge asked, though his tone suggested he already knew the answer. The ones where Connor Whitmore is on one side and everyone else is on the other, Kira said. The ones that say I saved 11 Marines but lost one. The ones that won't balance no matter how many lives I save, no matter how many shifts I work, no matter how hard I try. McClellan had been standing silently, processing everything. Now he stepped forward, his military bearing evident in every movement. What was the unit? I need to know the whole story. Kira looked at him, weighing her options for perhaps 3 seconds. Then she realized there was no point in hiding anymore. The truth was bleeding out across the trauma bay floor, impossible to contain, impossible to take back. Marine Special Operations Command, MARSOC Team 3. I was attached as their Navy corpsman. We deployed to Afghanistan in March 2018. The mission in question was classified, operation name Phantom Reaper. Raid on a suspected Taliban weapons cache near the Pakistan border. We went in at 0400 hours local time, 12 Marines plus me. It was supposed to be routine intelligence gathering and equipment seizure. She closed her eyes, and when she spoke again, her voice became distant, mechanical, reciting facts to avoid feeling emotions. The clinical detachment of someone giving a mission debrief rather than reliving trauma. The intelligence was wrong, not just incomplete or outdated, wrong. Fundamentally, catastrophically wrong. There was no weapons cache. It was a trap, a prepared ambush with overwhelming force. They were waiting for us. We walked into that compound and it was like walking into hell. IED took out our lead vehicle before we even reached the main building. The explosion was massive, purpose-built to destroy an armored Humvee. 5 Marines were wounded immediately from the blast in shrapnel. Before we could even respond, we were taking fire from 3 sides. At least 30 insurgents, maybe more. RPGs, AK-47s, PKM machine guns. They had the high ground. They had prepared positions. They had every advantage except one. "What was that?" Aldridge asked quietly. "They didn't have me," Kira said simply. "They didn't have a corpsman who refused to let Marines die." She opened her eyes and everyone in the room saw the haunted look in them, the 1,000-yard stare of someone who had seen combat and been marked by it permanently. "I went to work. That's what you do in combat. You don't think. You don't feel. You just work." Tourniquet on Corporal Garrett Hayes, femoral artery pumping blood that we couldn't afford to lose. Chest seal on Lieutenant Nash Foster, sucking chest wound that was pulling air into his pleural cavity with every breath. Needle decompression on Holbrook because his lung had collapsed and his heart was being compressed. 3 other Marines with shrapnel wounds, 2 with compound fractures, 1 with a traumatic amputation of 3 fingers. Patricia had sat down, her face pale. Walsh was leaning against the wall, his eyes wide. Even McClellan, who had been there and knew the story, looked shaken hearing it described so clinically. "And we were still taking fire," Kira continued, her voice never wavering. AK rounds hitting the vehicle we were using for cover, sparks and fragments flying everywhere, RPGs exploding close enough that I could feel the overpressure in my chest, close enough that I was temporarily deafened by the blasts. But I kept working. 17 minutes from the initial explosion to when the medevac birds finally arrived. The longest 17 minutes of my life. "How many?" Aldridge asked. "How many did you treat?" 8 critical, 3 urgent, 11 total. I worked on all of them, sometimes simultaneously, prioritizing who was closest to death, who could wait 30 seconds, who would die if I didn't get to them immediately, making triage decisions that no 20-year-old should ever have to make. 20? Walsh's voice was shocked. "You were 20 years old when this happened?" 21 by the time of the mission. Joined the Navy at 18. 2 years of training to become a corpsman, then additional training for Special Operations Attachment. I was the youngest member of the team by 3 years. Kira's voice held a bitter edge. Young enough to still believe I could save everyone. Old enough to learn that sometimes your best isn't good enough. "Connor Whitmore," Aldridge said gently. "Tell us about him." Kira's composure finally cracked. Her voice, which had been steady through the recitation of tactical details, broke when she spoke Connor's name. "He was 19, just turned 19 2 weeks before the mission. Farm kid from Montana, small town called Red Lodge. Joined the Marines because his father had been a Marine, and his grandfather before him. 3 generations of Whitmores serving their country. He was our designated marksman, our spotter, best shot on the team, could hit targets at distances that seemed impossible. But more than that, he was good, genuinely good, the kind of person who believed in honor and duty and protecting the innocent. The kind of person who made you want to be better. She wiped at her eyes with the back of her hand, leaving a smear of Holbrook's blood on her cheek. When the medevac birds came in, we had to move fast. The LZ was hot, insurgents closing in from multiple directions. I was loading the wounded. Connor was providing covering fire from an elevated position, using his rifle to keep the enemy at bay. And then, she stopped, her jaw working. Then he called on the radio, said insurgents were flanking our position from the east, said he could slow them down, give us time to get everyone loaded, said, she took a shuddering breath. He said, "Tell Doc I bought her time, get our guys out." Those were his last words. Not a goodbye to his family, not a message for his girlfriend back home, just a tactical report and a message for me. And I was loading the last wounded Marine when the RPG hit his position. I saw the flash, heard the explosion, and then the secondary IED detonated, and I don't remember anything after that. Just waking up 3 days later and learning that Connor was gone, and that officially, so was I. McClellan's voice was rough with emotion. We recovered what we could of him. It wasn't much, but his family got to bury something. His mother kissed the closed casket and told me to thank his corpsman for trying, for keeping the others alive. She said at least some mothers got their sons back whole. He paused. I didn't know how to tell her that the corpsman was supposedly dead too, that Connor had died protecting you, and you died anyway. Except I didn't, Kira said. I lived, and I've spent 8 years trying to figure out if that was a gift or a curse. The trauma bay doors opened again. A surgical nurse appeared, looking harried. We're taking him up now. Dr. Walsh, they need you in the OR. The anesthesiologist wants to review the patient's history before we start. Walsh nodded, started to leave, then turned back. Kira, we're going to talk about this, all of it. But right now that Marine is alive because of you. Again. That's worth something. After he left, the room fell silent again. Kira slumped into a chair, her adrenaline finally fading, leaving only exhaustion and the weight of 8 years of secrets suddenly exposed. What happens now? She asked quietly. Now, McClellan said, pulling out his phone, I make some calls. Because Holbrook was right. The team deserves to know you're alive. No, Kira said, standing abruptly. Gunny, please. You can't tell them. You don't understand what could happen. Then explain it to me, McClellan said. Make me understand why I should let them continue thinking you're dead when you're standing right here in front of me. Because the people who declared me KIA weren't just protecting mission details, Kira said urgently. They were protecting careers, high-ranking careers, officers who authorized that mission based on intelligence that should have been questioned, politicians who pushed for aggressive operations without adequate support, the kind of people who don't like being proven wrong, who don't like questions about their decisions, getting Marines killed. So what? McClellan said. You think I care about protecting some colonel's career? You think any of us would choose that over knowing you're alive? It's not about what you choose, Kira said. It's about what they'll take from you if this comes out. They'll investigate the mission. They'll pull you all in for testimony. They'll question every decision, every action, every casualty. They'll go after your medical records, your disability claims, your benefits. They'll make your lives hell to protect themselves, and your families will suffer for it. Maybe, McClellan said, or maybe it's time someone held them accountable. Maybe it's time the truth came out about what happened that day, about bad intelligence and good Marines dying because someone couldn't admit they were wrong. He looked down at his phone, his thumb hovering over a contact name. I'm calling Nash Foster. He's going to want to know. They all will. And then we're going to figure this out together, as a team, the way we should have 8 years ago. Please, Kira said, but her voice had lost its strength. She knew she had already lost this battle. The truth was out, spreading like blood across white linoleum, impossible to contain. McClellan pressed the call button. The phone rang once, twice, then a voice answered. Even from across the room, they could hear the confusion. "McClellan? It's almost midnight. What's wrong?" "Nash," McClellan said, his voice steady but filled with emotion. "I need you to sit down. I need you to listen to what I'm about to tell you and not hang up, no matter how insane it sounds." "You're scaring me, Gunny." "Good. You should be scared, because I'm about to tell you something that's going to change everything." McClellan looked directly at Kira as he spoke. "Korsman Brennan is alive. She's been alive this whole time, and we need to bring her home." The voice on the other end exploded. Even from across the room, they could hear the shouting, the disbelief, the desperate hope mixing with confusion and anger. McClellan held the phone away from his ear, letting Nash vent, his eyes never leaving Kira's face. When Nash finally fell silent, McClellan brought the phone back up. I know how it sounds, but I'm looking at her right now. She just saved Holbrook's life. He's in surgery. She put a chest tube in him, just like she did in Afghanistan. Same hands, same skill, same corpsman." He paused. "We're going to need everyone. Tomorrow. All of them. Can you make the calls?" There was a long silence. Then Nash's voice came through, quieter now, shaking with emotion. "Tomorrow. Where?" "VA Hospital, Tucson. I'll text you the details." McClellan ended the call and looked at Kira. "They're coming, all of them. The ones who are still in the area, and the ones who will drive or fly to get here. Because that's what Marines do. We take care of our own, and that includes our corpsmen, especially our corpsmen." Kira stood there, feeling the walls of her carefully constructed world crumbling around her like a sandcastle in rising tide. For 8 years she had been invisible, safe in her anonymity. And now, with a few phone calls, that invisibility was being stripped away. Colonel Aldridge wheeled closer. His voice was gentle but firm. "You can't run from this anymore, Kira. The truth is out. The only question now is what you're going to do with it." Kira looked at him, at McClellan, at Patricia, who was still sitting there in shocked silence. "I don't know," she admitted. "For 8 years I've known exactly what to do. Work. Save lives. Don't think about the past. Don't let anyone get close. Don't let anyone see me. And now all of that is gone, and I don't know who I'm supposed to be anymore." "Maybe," Aldridge said, "you're supposed to be who you always were. Corpsman, First Class, Kira Brennan. The woman who saved 11 Marines against impossible odds. The woman who's been saving lives every day since, even though no one knew her real name. Maybe you're supposed to stop hiding and start living." "I don't know how to do that," Kira whispered. "Then we'll teach you," McClellan said, "starting tomorrow when your team comes home." Kira walked to the window of the trauma bay, looking out over the parking lot where dawn would come in a few hours. Somewhere out there, phones were ringing. Marines were receiving impossible news. Families were being told that the corpsman they thought was dead had been alive all along. And tomorrow, she would have to face them all. Face their questions, face their anger, face their grief that had been reborn as confused joy. "I'm scared," she said quietly. "Good," Aldridge replied. "Means you're still human, still feeling. That's more than you've allowed yourself in 8 years." Morning came too quickly. Kira hadn't gone home after her shift ended. Instead, she'd stayed at the hospital, sitting in the chapel, a small room with wooden pews and stained glass windows that filtered the rising sun into patterns of colored light. She sat in the back row, her head bowed, not praying exactly, but trying to find some kind of center, some way to prepare for what was coming. Colonel Aldridge found her there at 7 a.m. He wheeled himself into the chapel quietly, respecting the sacred space even though both of them knew this wasn't about religion. It was about finding peace in a world that had suddenly become chaotic. "They're already starting to arrive," Aldridge said softly. "McClellan set it up for 2 this afternoon, but Marines don't do things by half measures. Nash Foster got here at 6 this morning, drove all night from San Diego. Garrett Hayes is flying in from North Carolina, should land around noon. They're calling everyone. Kira looked up, her face pale with exhaustion and dread. How many? Last I heard, at least 40, maybe more. Word spreads fast in the military community, especially among special operations units. Some are active duty who can't get away, but the ones who can are coming, and they're bringing families. Families, Kira repeated, the word heavy with implications. Wives, children, people who exist because I kept their husbands and fathers alive 8 years ago. That's right, Aldridge said. You saved those men, and those men went on to have lives, to build families, to create futures. Your actions rippled outward in ways you never saw, never knew about, because you were too busy hiding to see what your sacrifice created. Kira stood, her body stiff from sitting too long in the uncomfortable pew. I need to check on Holbrook, see how he came through surgery. He's stable, Aldridge said. I already checked. The surgery took 4 hours. They removed the bullet from near his left ventricle. Another millimeter, and it would have pierced the heart wall. He's lucky. Again. Because of you. Again. They made their way to the surgical ICU, where Holbrook lay in a bed surrounded by monitors and IV lines. His face was pale but peaceful, the lines of pain smoothed away by medication. A nurse was checking his vitals when they arrived. How is he? Kira asked. The nurse, a middle-aged woman named Sandra, who Kira had worked with before, looked up with a smile. Stable, strong vitals. He woke up briefly about an hour ago, asked about you, wanted to make sure you were real and not a morphine hallucination. She glanced at Kira with curiosity. He said some interesting things while he was coming out of anesthesia. Something about Afghanistan and saving his life twice. Anesthesia makes people say strange things, Kira said diplomatically. Mm-hmm, Sandra replied, clearly not believing that, but professional enough not to push. Well, your strange-talking patient should make a full recovery. He'll be here for a few days, then probably a week or two of recovery at home. The bullet missed everything critical by what the surgeon called an act of God or incredible luck. Or good medicine, Kira said quietly. She stood by Holbrook's bedside, looking at his sleeping face. 8 years ago, she had worked on him in a desert compound while the world exploded around them. She had put her hands inside his chest cavity to insert a drainage tube, had kept him alive through sheer will and skill and desperation. And here he was again, alive because she had been in the right place at the right time with the right training. His eyes fluttered open. For a moment, they were unfocused, confused by medication and surroundings. Then they found her face, and clarity returned. Not a dream, he mumbled. You're real. I'm real, Kira confirmed. Made the calls, Holbrook said, his words slightly slurred but understandable. Before surgery, told Nash, told McClellan to gather everyone. Hope that's okay. It's not okay, Kira said, but without heat. But it's done now. Can't take it back. Good, Holbrook said. Shouldn't be taken back. Face it. Together. As a team. Way we face it. Together. As a team. Way we should have 8 years ago. His eyes closed again, exhaustion pulling him back towards sleep. Thank you, Doc, for saving me. Both times. Kira reached out and squeezed his hand gently. Get some rest, Marine. At 1:30 p.m., Kira stood in a small conference room adjacent to the hospital courtyard, looking through the window at what had been assembled. Someone had set up chairs in neat rows facing a small raised platform. American flags hung from poles on either side, and Marines were arriving. Not just the 11 she had saved, but dozens more. Some in dress blues, some in civilian clothes, but all carrying themselves with unmistakable military bearing. She recognized faces. Nash Foster, older now but still moving with the controlled precision of someone who had been trained to perfection. Garrett Hayes, broader than she remembered, with gray threading through his dark hair. And with Hayes was a small girl, perhaps 6 or 7, with dark curls and enormous brown eyes. That's Sophie, Aldridge said quietly from beside her. Garrett's daughter, born about a year after he got back from Afghanistan. She wouldn't exist if you hadn't kept her father alive. Kira's throat tightened. She had known intellectually that the men she saved had gone on to have lives. But seeing the proof, seeing a living child who existed because of her actions, made it visceral and overwhelming. More Marines arrived. Some she recognized, some she didn't. Wives holding children, elderly parents who had to be the mothers and fathers of the men she'd saved. A group of young Marines, teenagers barely old enough to serve, who must have been inspired by the stories of the men who had survived. At exactly 2 p.m., McClellan appeared at the conference room door. "They're ready," he said simply. Kira felt paralyzed. "I can't do this." "Yes, you can," Aldridge said firmly. "You ran toward gunfire to save these men. You can walk 20 feet to talk to them." "That was different. That was combat. I knew what to do in combat. This is combat too," Aldridge interrupted. "Just a different kind. The kind where you have to be honest instead of heroic. The kind where you have to accept that people care about you, even when you don't think you deserve it. The kind where you have to let go of guilt and accept gratitude." He paused. "Harder than any firefight, but you can do it." With legs that felt like lead, Kira followed McClellan into the courtyard. The moment she appeared, every conversation stopped. Every eye turned to her. The silence was absolute and overwhelming. Then Nash Foster stepped forward. He was taller than she remembered, with captain's bars on his dress uniform and scars on his face that hadn't been there before. He came to attention and saluted, his hands snapping to his brow with perfect precision. "Corpsman First Class Brennan," he said, his voice carrying across the courtyard. "Permission to approach." Kira found her voice somehow. "Granted." Nash crossed the distance between them in 5 strides. Then, to everyone's surprise, he pulled her into a fierce hug, lifting her off her feet. "8 years," he said into her hair, his voice breaking. "8 years I've carried the guilt of surviving when you didn't. 8 years of wondering if there was something I could have done differently, if I could have protected you better, if I could have prevented your death." He set her down, his eyes bright with tears. "And here you are, alive, real, breathing." Before Kira could respond, Garrett Hayes was there with his daughter. The little girl stared at Kira with wide, curious eyes. "Daddy says you're an angel," Sophie said with the blunt honesty of children. "Are you? You don't look like an angel. Angels have wings and halos and stuff." Kira knelt down to the girl's eye level. "No, sweetheart, I'm not an angel. I'm just a nurse." "But Daddy says you saved his life. He says you're the reason I have a daddy." Sophie held out a piece of paper. "I drew you a picture to say thank you." The drawing was crude in the way of children's art, stick figures and bright colors, but the image was clear. A woman in military fatigues holding the hand of a man on the ground, with the words, "Thank you for saving my daddy," written across the top in unsteady letters. Kira took the drawing with trembling hands. Something inside her chest, something that had been frozen for 8 years, began to crack. "Thank you, Sophie. This is beautiful." Garrett picked up his daughter and extended his hand to Kira. "It's good to see you, Doc, even if it means the last 8 years have been based on a lie. Even if it means everything we thought we knew was wrong. It's good to see you alive." One by one, they came forward. Marines she had saved, wives she had never met, children who existed because their fathers had survived. Each one had a story. Each one had been affected by her actions in ways she had never imagined. Lieutenant Nash Foster's sister, a woman in her 30s with kind eyes, approached with tears streaming down her face. "You saved my brother. He walked me down the aisle at my wedding 3 years ago. My father died when we were young, and Nash was all I had. If you hadn't—" She couldn't finish, just pulled Kira into another hug. The elderly couple she had noticed earlier came forward. The man wore an old Marine uniform with ribbons from Vietnam. The woman's face was weathered but kind. "We're Thomas and Eleanor Whitmore," the woman said softly. "Connor's parents." Kira felt as if she'd been punched in the chest. All the air left her lungs. These were Connor's parents, the people who had raised him, who had lost him, who had buried an empty casket believing both their son and his corpsman were dead. "I'm so sorry," Kira gasped. "I'm so sorry I couldn't save him. I tried. I swear I tried. But I was too slow, or not skilled enough, or—" "Stop," Thomas Whitmore said firmly. His voice had the authority of a man who had served, who understood combat, who knew the difference between failure and impossible circumstances. "My son made a choice, a Marine's choice. He saw what needed to happen, and he did it. That wasn't your fault. That was his honor." Eleanor pressed something into Kira's hand, a photograph. Connor, in his dress blues, smiling at the camera with that easy grin that she remembered so well. On the back, in Connor's handwriting, was a message. "He wrote that before his last deployment," Eleanor said. "We found it in his belongings after. It was addressed to his corpsman, but they told us you were dead too, so we've kept it. But I think Connor would want you to have it now." Kira turned the photograph over and read the words through tears that blurred her vision. "Doc, if you're reading this, something went wrong. But here's what you need to know. It was worth it. Every training exercise, every deployment, every moment of fear and brotherhood and purpose. It was all worth it. If I didn't make it back, don't you dare blame yourself. You're the best corpsman any Marine could ask for. You kept us alive against impossible odds. You gave everything you had and then found more. Whatever happened to me, I made a choice. Honor that choice by living well, by saving more lives, by being the person we all believed you were. Semper Fidelis. PFC, Connor Whitmore." Kira's carefully maintained composure shattered completely. 8 years of suppressed grief and guilt came pouring out. She sobbed, her body shaking with the force of emotion she had denied for so long. Aldridge wheeled closer, and she collapsed against his chair, unable to stand under the weight of it all. Eleanor Whitmore knelt beside her, this woman who had lost her son, and put her arms around the person who had tried and failed to save him. "He forgave you before he even died, honey. He understood. He knew you did everything you could. Now you need to forgive yourself." The crowd of Marines and families watched in respectful silence as Kira broke apart and was slowly put back together by the kindness of strangers who weren't strangers at all. They were the people she had saved, the people whose lives she had changed, the people who had been waiting 8 years to thank her. When Kira finally regained some measure of control, McClellan stepped forward to the platform. His voice carried across the courtyard with military precision. "We're here today to honor someone who should have been honored 8 years ago. Someone who gave everything to keep her Marines alive. Someone who worked miracles under fire and asked for nothing in return except that we make it home safe." He opened a polished wooden case that had been placed on the platform. Inside, resting on blue velvet, was a medal. The Navy Cross, its distinctive ribbon and bronze star catching the afternoon sunlight. This was approved 8 years ago as part of Corpsman Brennan's official casualty package. It was going to be presented to her family at her memorial service, but she didn't have any family listed in her service records. No parents, no siblings, no next of kin. So it got filed away in some bureaucrat's office, waiting for someone to claim it. McClellan lifted the medal from its case. "We're claiming it now, on her behalf, because she earned it, because she deserves it, and because we'll be damned if we let them erase what she did for us." He gestured for Kira to join him on the platform, of hands rising to brows. 40 men of hands rising to brows. 40 men honoring the woman who had refused to let them die. "Corpsman First Class Kira Brennan," McClellan said formally, his voice carrying to every corner of the courtyard, "for extraordinary heroism in action against armed enemy forces on October 14, 2018, in Helmand Province, Afghanistan. Despite being under intense enemy fire and with complete disregard for her own safety, Corman Brennan provided life-saving medical treatment to 11 critically wounded Marines over a sustained period of 17 minutes. Working in exposed positions while enemy forces closed to within 50 meters, she performed advanced trauma procedures, including emergency thoracotomies, bilateral needle decompressions, and damage control surgery using only the materials at hand. Her actions directly resulted in 0 fatalities among friendly forces, despite overwhelming enemy superiority and catastrophic initial casualties. Her courage, skill, and dedication to her Marines represent the highest traditions of military service and the finest qualities of the United States Navy. He pinned the Navy Cross to her shirt, right over her heart. The weight of it was surprisingly heavy. Or maybe that was just the weight of acceptance, of finally allowing herself to believe that she had done something worth honoring. The Marines held their salute, unmoving, their eyes locked on her with a respect and gratitude that was almost painful to receive. "At ease," Kira said softly, and 40 hands dropped in unison. She looked out at the crowd, at all these faces, all these lives that had continued because of 17 minutes of desperate medicine in a desert compound half a world away. She opened her mouth to speak, to try to put into words what she was feeling, but nothing came out. How did you thank people for forgiving you? How did you accept gratitude when you still carried so much guilt? Then movement at the back of the crowd caught her eye. A young Marine was pushing through, moving with the urgent purpose of someone on a mission. He was perhaps 19, with blonde hair cut high and tight, blue eyes that were achingly familiar, and a face that made Kira's heart stop. He looked exactly like Connor Whitmore. The young Marine made his way to the front and came to attention before the platform. He saluted with perfect precision, his voice steady despite the emotion evident in his eyes. "Ma'am, Lance Corporal Ethan Whitmore, reporting, United States Marine Corps. Connor Whitmore was my brother." The courtyard fell absolutely silent. Every eye turned to this young man who carried the face of the fallen. Thomas and Eleanor Whitmore had tears streaming down their weathered faces, seeing their lost son reflected in their living one. Kira stared at Ethan, unable to process what she was seeing. It was like looking at a ghost, but wrong. Connor had been darker, more weathered by his time in combat. Connor had laughed more easily, had carried himself with the confidence of someone who had proven himself in battle. But the eyes were the same. The set of the jaw was the same. The way he stood, balanced and ready, was heartbreakingly familiar. "I enlisted 2 years ago," Ethan said, his voice carrying to the assembled crowd. "As soon as I turned 18, my parents didn't want me to." He glanced at his mother and father. Apology and determination mingled in his expression. "They said they'd already lost one son to the Marines, but I had to. I had to understand what Connor died for, had to see if it was worth it, if his sacrifice meant something." "And?" Kira's voice was barely a whisper. "Did you find your answer?" Ethan reached into his pocket and pulled out a letter, folded and refolded so many times that the creases were worn thin. The paper was soft, almost fragile, aged by time and handling. "Connor wrote this before his last deployment. Made me promise that if anything happened to him, I'd find his corpsman and give it to her. But they told us you were dead too. So I carried it, kept it with me through boot camp, through School of Infantry, through everything. Thought maybe I'd get to give it to you in heaven or something." He held it out with both hands, as if it were something sacred. "But apparently heaven can wait." Kira took the letter with shaking hands. The paper was warm from being carried close to Ethan's body, and she could see Connor's handwriting on the front. "To Doc Brennan, for after." Her vision blurred with tears, but she forced herself to read. "Doc, if you're reading this, it means I didn't make it home. And knowing me and my luck, it probably means I did something that looked stupid, but was actually necessary. I'm guessing I stayed behind when everyone else made it to the bird, or I took point when someone else should have, Or I did one of those Marine things that sound heroic in the retelling, but felt like the only option at the time. Here's what I need you to know, and I need you to really hear this, Doc. Don't blame yourself. I know you will, because that's who you are. You take responsibility for everything, every casualty, every wound, every Marine who doesn't make it home, perfect and whole. But this one's on me. This one's my choice. I joined the Marines because my dad was a Marine, and his dad before him. 3 generations of Whitmores serving this country. I joined because I believed in something bigger than myself, something worth dying for if it came to that. And I found it in our team. Found it in the brotherhood, in the mission, in the knowledge that we were doing something that mattered. But most of all, I found it in watching you work. Doc, I've seen you do things that shouldn't be possible. I've watched you bring men back from the edge of death with nothing but your hands and your will and your absolute refusal to give up. I've seen you work on 3 Marines simultaneously while mortars were landing close enough to feel the concussion. I've seen you make impossible decisions with a calmness that still amazes me. You need to know something important. Every Marine on that team would have taken a bullet for any other Marine. That's not heroism. That's just who we are. It's what we signed up for. So if I took a bullet or an RPG or whatever got me, it's because that's the job. That's what Marines do. We stand between danger and the people who need protecting. And that includes our corpsmen, especially our corpsmen. You gave us everything, every bit of skill, every moment of focus, every ounce of determination. You kept us alive when we should have died. You gave us futures we wouldn't have had without you. So if I bought you time with my life, that's not a tragedy, that's mathematics. 1 life to save 11. 1 young Marine to give 11 others the chance to go home, to see their families, to have children and build lives, and do all the things people do when they're not getting shot at in the desert. Don't waste your life feeling guilty about mine. Don't spend decades wondering if you could have done something differently. You did everything right. You were perfect. And if my sacrifice meant you survived to save more lives, then it was worth it. More than worth it. Live for both of us, Doc. Live big, save lives, fall in love, eat good food and watch sunsets and laugh at stupid jokes. Do all the things I won't get to do and do them well. That's how you honor me, not by mourning, not by punishing yourself, by living so fully that my sacrifice created something beautiful. Tell my brother Ethan that being a Marine is the hardest and best thing I ever did. Tell him that if he decides to serve, he should serve with honor. But tell him it's okay if he doesn't. Not everyone has to wear the uniform. Some people honor their family by living well and being good humans. That's enough. Tell my parents I love them, and I'm sorry I put them through this. Tell them I died doing something that mattered, protecting people who needed protecting. And tell yourself every day that you did everything you could, that you saved everyone who could be saved, that you're allowed to survive, that you're allowed to be happy, that Connor Whitmore thinks you're the best corpsman the Corps has ever had, and he'd be proud to know you continued to save lives for years after his was done. Semper Fidelis, Doc. Always faithful, always forward, always worth it. Your Marine, PFC Connor Whitmore. Kira's hands trembled so badly that Ethan gently took the letter back, afraid she would drop it. She stood there on the platform, tears streaming down her face, her entire body shaking with sobs she couldn't control. Every defense, every wall, every protection she had built over 8 years of guilt and isolation came crashing down. "He forgave me," she gasped. "Before he even died, he forgave me. He told me to live. He gave me permission to survive." "More than that," Ethan said softly. "He gave you a mission. He told you to save more lives, to honor his sacrifice by being the person he believed you were." He paused. "So I'm asking you to honor that mission. I deploy to Africa in 6 weeks. Humanitarian mission. Medical support for coalition forces. We need corpsmen. Experienced corpsmen who know what they're doing, who can teach the rest of us how to be as good as you are. He came to attention again, his voice taking on a formal tone. Ma'am, I'm requesting that you train me. Train me the way you would have trained Connor. Teach me how to be the kind of corpsman who never gives up, who never stops fighting, who brings everyone home. I want to honor my brother by being worthy of his sacrifice. And I can't think of a better way to do that than learning from the person he trusted with his life. Kira looked at this young man, this echo of someone she had lost, and saw in his eyes the same determination, the same belief, the same willingness to serve that had driven his brother. And she realized that Ethan was offering her something precious. Not forgiveness, because Connor had already given her that, but purpose. A way to transform grief into action. A way to honor Connor by making sure his brother had every possible skill to survive. The weight of Connor's letter, Connor's permission to live, Connor's faith that she was worth saving, settled over her like a benediction. For 8 years, she had been trying to earn the right to survive, but Connor had already given her that right, had given it freely, without conditions, with nothing but his belief that her life was worth his sacrifice. Yes, she said, her voice growing stronger with each word. Yes, I'll train you. I'll teach you everything I know. Field medicine, combat triage, how to work under fire, how to make impossible decisions, how to save lives when everything is going to hell around you. She looked past Ethan to the assembled Marines, to McClellan and Hayes and Foster and all the others. I'll train all of you, every corpsman who deploys with Marines, every medic who might have to make the choices I made. I'll make sure they're ready. I'll make sure they come home, because that's how I honor Connor. That's how I honor all of you. Not by hiding, not by punishing myself, but by making sure the next generation is better prepared than I was. McClellan smiled, and it transformed his stern face into something almost gentle. That's what I wanted to hear, Doc, because I pulled some strings, made some calls, and the Navy wants you back. Not for combat, for training. They want to build a new combat medicine program at Naval Medical Center, San Diego. Advanced trauma care based on real-world special operations experience. Based on what you did in Afghanistan. Based on the skills that kept 11 Marines alive against impossible odds. He paused. They want you to be the lead instructor, to design the curriculum, to train the next generation of combat corpsmen, to make sure what happened to Connor never has to happen again because a corpsman wasn't skilled enough or prepared enough. Kira stared at him, her mind struggling to process this information. The Navy wants me back? After 8 years? After everything? They never wanted you gone in the first place, Aldridge said, wheeling himself closer to the platform. The people who made you disappear were bureaucrats and politicians protecting their own interests. But the warriors, the ones who actually fight, they always knew your value. They just thought you were dead. Now that you're not, they want to make sure your knowledge doesn't die with you. They want to make sure every corpsman has the chance to learn from the best. Kira looked down at the Navy cross pinned to her chest, felt the weight of it, the responsibility of it. She looked at Ethan Whitmore, who carried his brother's face and his brother's determination. She looked at the 11 Marines she had saved and the families they had built, and the children who existed because of 17 minutes of desperate medicine in a desert far away. And for the first time in 8 years, she felt something she thought she had lost forever. Purpose. Not the hollow purpose of working herself to death to atone for surviving, but real purpose, the purpose of teaching, of mentoring, of making sure that the next generation of corpsmen was so well trained that maybe, just maybe, fewer Marines would die because their medic wasn't ready. I'll do it, she said. I'll go back. I'll build the program. I'll train them all. But I have conditions. McClellan raised an eyebrow. You're negotiating with the United States Navy? Damn right I am, Kira said, and for the first time in 8 years, she felt something like strength returning. I want full access to combat medicine research from all services, not just the Navy. I want to work with Army Special Forces medics, Air Force PJs, Marine Recon corpsmen. I want to learn from everyone and build something better than what currently exists. I want to develop new protocols based on what actually works in the field, not what looks good on paper. And I want to make sure that no corpsman ever feels what I felt. Alone, undertrained, making life and death decisions with inadequate preparation. Done, Aldridge said immediately. I'll make the calls. I still have friends in positions of authority, friends who owe me favors. By this time next week, you'll have everything you need. He paused. On one condition of my own. You let me help. You let me be part of this program, not as an instructor, but as a mentor. Someone who understands what these young corpsmen will face when they come back from combat. Someone who can help them process what they've seen and done. Someone who can make sure they don't spend 30 years trying to destroy themselves the way I did. Kira looked at this old colonel who had seen through her disguise, who had refused to let her hide, who had pushed her toward this moment even when she fought against it. I'd be honored, Colonel. The ceremony continued for another hour. Marines came forward to share their stories. Wives thanked her for giving them their husbands back. Children showed her drawings and told her about their lives. And through it all, Kira felt the ice that had encased her heart for 8 years slowly melting. As the sun began to set, casting long shadows across the courtyard, the crowd began to disperse. Marines said their goodbyes, promising to stay in touch, to support the new training program, to never forget what she had done for them. Families gathered their children, and slowly Kira found herself alone with Aldridge, McClellan, Ethan, and Connor's parents. Thomas Whitmore approached her one last time. His old Marine uniform still fit him perfectly, and the ribbons on his chest spoke of service in another war, another time. My son Connor believed in you, he said simply. He believed you were worth dying for, and I can see now that he was right. You've spent 8 years proving him right. Now it's time to stop proving and start living. Eleanor hugged her tightly. Welcome back to the world, dear. Welcome back to life. After they left, Kira stood with Ethan in the empty courtyard. The flags had been taken down. The chairs had been stacked. But the meaning of what had happened here remained, settling into her bones like knowledge, like purpose, like permission. When do we start training? Ethan asked. Tomorrow, Kira said. If you're serious about this, we start tomorrow. Because 6 weeks isn't much time, and I'm going to make sure you're ready. Really ready. Connor level ready. Ethan smiled, and for just a moment, it was Connor's smile. Yes, ma'am. I'll be here. 3 months later, Kira stood in a classroom at Naval Medical Center, San Diego, facing 20 young corpsmen who looked terrified and eager in equal measure. They were about to begin the most intensive combat medicine training program the Navy had ever developed, and Kira was their lead instructor. On the wall behind her hung a photograph. 20 Marines and 1 corpsman, standing in the Afghan desert, arms around each other's shoulders, smiling despite the harshness of their environment. The photo was no longer hidden in a closet. It was displayed proudly, a reminder of what they were training for, who they were training to protect. Next to it hung a second photograph. Connor Whitmore in his dress blues, that easy grin on his face, his eyes full of life and purpose. Beneath it, a plaque with his final message. Live well enough that my sacrifice meant something. Ethan Whitmore sat in the front row, his notebook open, his pen ready. He had delayed his deployment by 3 months to complete this training, and he approached it with the intensity of someone who understood the stakes. Around him sat 19 others, each one chosen for their potential, their dedication, their willingness to learn. Good morning, Kira said, her voice steady and strong. I'm Kira Brennan. 8 years ago, I was a Navy corpsman attached to a Marine Special Operations team in Afghanistan. During a classified mission that went catastrophically wrong, my team was ambushed. I had 17 minutes to treat 11 critically wounded Marines under intense enemy fire. I saved all 11. One Marine, Private First Class Connor Whitmore, died covering our extraction so that the rest of us could survive. She paused, making eye contact with each student. I'm going to teach you how to do what I did. I'm going to teach you how to keep Marines alive when everything is trying to kill them. I'm going to teach you how to work under pressure that most people can't imagine. I'm going to teach you how to make life and death decisions in seconds. And I'm going to make sure that when you deploy, you're so well trained that the Marines you serve with have the best possible chance of coming home. She walked to the whiteboard and wrote 3 words in large letters: skill, speed, certainty. These are the 3 pillars of combat medicine. Skill is what you learn here, in this classroom, and in training scenarios. Speed is what you develop through practice, through repetition, through making the procedures so automatic that you can do them in your sleep. Certainty is what you build through preparation, through knowledge, through understanding that you have the training to handle whatever combat throws at you. She turned back to face the class. By the time you leave this program, you will have all 3. You will be ready for anything. You will be able to save lives under the worst possible circumstances. And you will bring your Marines home. That's not a hope or a wish. That's a guarantee, because I'm going to make sure of it. The class sat motionless, absorbing her words, feeling the weight of responsibility settling onto their young shoulders. Ethan raised his hand. Ma'am, permission to ask a question? Granted. How do you live with it, the ones you can't save? How do you keep going when you've done everything right and it still wasn't enough? The classroom fell silent. It was the question they all wanted to ask but were afraid to voice. The question that went to the heart of what it meant to be a combat corpsman, to hold lives in your hands and know that sometimes your best wouldn't be good enough. Kira looked at Ethan, at this young man who carried his brother's face and his brother's legacy, and she gave him the truth. The truth she had learned over 8 years of hiding and 1 moment of resurrection. You don't live with it, she said quietly. You live for it. You honor the ones you lost by saving the ones you can. You carry their memory, but you don't let it crush you. You understand that sometimes doing everything right still isn't enough. But that doesn't mean you stop trying. It means you try harder. It means you get better. It means you train so intensively that maybe, just maybe, next time you'll have 1 more technique, 1 more skill, 1 more second of speed that makes the difference. She touched the pocket where she now kept Connor's letter, always with her, always reminding her of his permission to live. You live well. You serve well. You make their sacrifice mean something by being the best corpsman you can possibly be. You wake up every day and choose to honor them through excellence, through dedication, through the refusal to let their deaths be meaningless. That's how you carry the fallen, not by joining them in death, but by living fully enough for both of you. The students nodded, understanding beginning to dawn in their young faces. This was more than a medical training program. This was a crucible that would forge them into something stronger, something better, something capable of standing between Marines and death. Now, Kira said, her voice becoming brisk and professional. Let's begin. We're starting with hemorrhage control, arterial bleeds, the kind of injury that gives you 90 seconds to act before your patient dies. 90 seconds to apply a tourniquet correctly, to pack a wound properly, to control bleeding that can drain a human body in less than 2 minutes. She held up a training mannequin, its artificial blood already prepared in the circulatory system. This is your Marine. He's been hit by shrapnel in the femoral artery. He's bleeding out. You have 90 seconds. What do you do? For the next 8 hours, she taught. She demonstrated techniques, corrected mistakes, shared knowledge earned through pain and loss and triumph. She showed them how to work with steady hands, even when their own hearts were racing. She taught them how to make decisions when there was no time to think. She gave them everything she had learned in that desert compound 8 years ago, and everything she had learned in the years since. When the class finally ended, the students filed out exhausted but energized, their minds full of new knowledge, their hands already moving through the motions they would practice until they became automatic. Ethan lingered, as he always did. "Ma'am, thank you for everything, for training me, for honoring Connor by making sure I'm ready." "Thank you," Kira replied, "for reminding me why this matters, for giving me a reason to stop hiding and start living." That evening, Kira sat in her new office at the Naval Medical Center. The space was small but comfortable, with windows overlooking the San Diego harbor. Photos covered the walls now, not just the team photo from Afghanistan, but others. Sophie Hayes's drawing, framed and prominent. A letter from Nash Foster's sister. A picture from the ceremony showing Kira surrounded by the Marines she had saved. And in the center of the desk, in a place of honor, was the photograph of Connor Whitmore with his final message beneath it. Colonel Aldridge wheeled in, carrying 2 cups of coffee. He had become a regular visitor, a mentor and friend who understood the long journey back from darkness. "How was the first day?" he asked. "Good," Kira said, and she meant it. "Hard, but good. They're eager to learn. Ethan especially. He has his brother's determination. And you? How are you?" Kira thought about the question, really thought about it. She considered the weight she still carried, the memories that would never fully fade, the scar tissue that had formed over 8 years of grief and guilt. But she also thought about the purpose she had found, the lives she would save, the Marines she would prepare. "I'm living," she said finally. "Actually living. For the first time in 8 years, I'm not just surviving. I'm not just going through the motions. I'm here, in this moment, doing work that matters, training people who will save lives, honoring Connor by making sure his sacrifice created something beautiful." She looked at Aldridge, this man who had refused to let her hide, who had pushed her toward this moment even when she fought against it. "Thank you, Frank, for seeing me when I was trying to be invisible, for refusing to let me destroy myself, for believing I was worth saving." Aldridge raised his coffee cup in a toast. To living then, to second chances, to warriors who refuse to give up, even when they're fighting themselves, to corpsmen who save lives even when they think they don't deserve to be saved. They drank in comfortable silence, watching the sun set over San Diego, painting the harbor in shades of orange and gold. Somewhere in Montana, Connor Whitmore's parents were reading a letter from their surviving son, telling them about the incredible training he was receiving from the woman who had saved his brother's teammates. Somewhere in North Carolina, Sophie Hayes was asleep, her angel drawing on her nightstand, dreaming of the woman who had given her a father. Somewhere in a dozen different cities, 11 Marines were living their lives, raising families, building futures, all because one corpsman had refused to give up during 17 minutes of hell. And in San Diego, in a small office in a military hospital, Kira Brennan sat with her coffee and her memories and her hard-won peace. The ghosts would always be there. Connor's face would always haunt her quiet moments. The sound of explosions would always echo in her nightmares. But now, alongside the ghosts, there was something else. Purpose. Connection. The knowledge that she hadn't wasted Connor's sacrifice, that his death had meaning, that the time he bought her had been used to save countless others. She was no longer the forgotten corpsman. She was Kira Brennan, instructor, mentor, guardian of the next generation. She was living for those who couldn't. And in that living, she had finally found peace. The war was over. The hiding was done. And the real work, the work of healing and teaching and honoring the fallen through service to the living, would continue for as long as she drew breath. This was her second chance, and she would not waste it.